right, there we go. Okay, Assalamu alaikum, everyone.
Walaikum assalam.
Welcome to our Tuesday program. Inshallah, we are joined by Dr. Kamil, inshallah, who will be going through and answering some questions about COVID-19. Dr. Kamil is a board certified, has her board certification in internal medicine and practices in Long Beach, California. So, Assalamu alaikum. Are you good?
Assalamu alaikum. How are you?
Good, alhamdulillah. How are you?
Good. Can you hear me okay?
Yeah.
Okay. Jazakallah khair for having me. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody.
Wa alaikum salam.
Right.
So how would you like to do this? Would you like me to just ask you the questions and then we'll go through them?
Yeah, that sounds right. We can just kind of have it interactive and.
Okay, perfect. Sounds good. So I guess we'll start out with the basics. So how is COVID-19 transmitted?
Okay, so we've heard a lot about it. It's mostly from respiratory droplets. So those are basically any kind of liquid particles that come from your respiratory system. So any sneezing, any coughing, pretty heavy talking, even singing, any of those basically brings droplets that are from your lungs and the upper part of your respiratory system, and it brings it out to the air. And if these droplets get into anybody else's eyes, nose, mouth, or any surface that is then touched and then also touches your eyes, nose, and mouth, that's how they get transmitted. The droplets can go up to 6 feet, and that's how we got the 6 feet rule. And that's the importance of masks and social distancing and hand hygiene, because all of those play an important step in blocking the transmission of droplets from an infected person to a non-infected person.
All right. So what is the deal with asymptomatic carriers?
So asymptomatic carriers, and they're, I guess, one of the most dangerous ways of transmitting people, because you feel fine, and then you're walking around, to the grocery store or to the mail, and then anything that you touch or anything that you sneeze, and if someone's within that 6 feet radius we talk about, you can be shedding these droplets and get other people also infected and therefore asymptomatic carriers as well. The period of incubation, or if you get the virus, it gets into your system, it goes all the way to the lungs, causes an inflammatory reaction, then you get your symptoms. That usually takes 5 to 7 days, but the maximum it's been reported is about 14 days. And that's where we get that 14-day rule from, where if you've been in contact with somebody who's sick, they ask you to kind of isolate for about 14 days.
Okay. So what kind of symptoms should we be looking for kind of when you're talking about within those 14 days?
So the most common one, when it first all started, there were 4 symptoms. They have now expanded, but the most common one is basically a dry cough, because that virus, it gets into the upper part of your throat, kind of causes an inflammatory reaction where you're coughing. And then usually the next day or the day after, you have a high fever. And when I say high, usually I mean above 100, 101. Kind of thing. And then as the virus goes lower into your lungs, you can have the pneumonia, the shortness of breath, the fatigue, the body aches, feeling like you can't get up. And these were the initial symptoms. And now that we know more and more about COVID-19, we're finding people presenting with headaches, nausea, vomiting, abdominal pain, some people with rashes, strokes. And this is a minority, but it's still a good amount that people come to the emergency room with a headache, and they found to be COVID-19 positive. And this is not to create alarm or anything, but just to know that these symptoms can also present as COVID-19.
Okay. So, given all these symptoms, a lot of people are talking about testing, and, a lot of people are keeping track of the numbers in different countries and states. So what is your recommendation regarding testing?
If it was possible, I'd recommend everybody to get tested. In LA County, I'm sure, I don't know if everybody knows, and I'll ask somebody to put the link down there. There's free testing for everybody. You don't have to be symptomatic. You don't have to be a certain age. Anyone can go get tested and you can get your results. And it's always good to know whether or not you've acquired it, because a lot of people, for my colleagues, they've gotten tests and they've just been surprised that they've been positive. Or I don't know if there's a thing that came out in the news recently from New York that a lot of people that were at home, supposedly sheltering at home, ended up being positive too. And that just shows that you can still get infected by very, minimal trips to the grocery store or picking up the mail or things like that. So I recommend everybody getting tested just to know what your status is, and especially if you have a lot of elderly or, medical patients with household contacts with medical conditions, that I always recommend getting tested, even if you've been home.
So just for clarification, getting tested would show you whether or not you are asymptomatic or you have active corona or COVID
at the time of, yeah. So it doesn't mean you can, now if you're negative, go enjoy life, because like everybody else around you can still be positive or shedding, right? So it just tells you at that moment whether you're either actively having it as symptomatic or asymptomatic.
So what about in terms of medicines or medication?
So I know there's been a lot in the media about medications. So far, nothing has been proven to either prevent or treat. There are a couple of medications in clinical trials, and they've been studied in patients who are pretty sick, and by that I mean in the intensive care unit. So I know one medication, Remdesivir, was approved by the FDA, and that's pretty much the only one that's been approved. There's a lot of clinical trials going on, not just in the US, but in Europe and other parts of the world where they're testing out different medications. And just a basic premise, the COVID-19 is a viral infection, right? So like the common cold is a virus. And, as if you've had a cold and, most of the time you don't get antibiotics for this because the body's meant to kind of clear this by itself. And same thing with this. So what the medications are doing is that inflammatory reaction that the body does, the excessive reaction of the lungs, it just kind of calms that down. So there's no per se cure, like how an antibiotic would treat sore throat or, a foot infection or a skin infection or things like that. It's mostly supportive care, how the body is reacting to it to kind of calm that down so that your lungs don't end up needing a vent or something like that, a breathing machine.
So just a reminder for everyone listening, if you have any questions or if anything does come up, feel free to put them in the chat and I'd be happy to read them out loud. So the next question that I have is regarding like Eid gatherings. I know that a lot of people are very much concerned. Eid's coming up and, we're in the last days of Ramadan. So what is your medical opinion?
And I know this is a very challenging question for me personally too, as a Muslim. Eid is associated with community and gathering and food and, seeing a lot of people. And unfortunately, it doesn't look like this Eid is going to be like that. There's talking in the news about extending the stay-at-home order in California. I personally don't think we should do large gatherings. Keep it immediate family, like you yourself know within your and your immediate family who's been social distancing and who's not. And so just keeping it immediate family is what I recommend. I don't recommend large gatherings and potlucks and all the stuff that we usually do, just because, again, you don't know who's been socially distancing, who's not. And even those who have, like I said, they can still be asymptomatic carriers. And you don't want, Eid to be the source of outbreak, in our local community. Yeah.
So in regards to vaccines or vaccination, what would be your take, or is there a vaccine?
So as of right now, there isn't. So just like to give a big picture, vaccines, like the typical, the amount of time it takes to develop is 10 years. So the Ebola vaccine took 5 years. And the reason it is because it's something we're injecting into people. We have to make sure it's safe. We have to make sure it works, make sure it doesn't cause, any kind of a reaction in a negative way. And so with the current science and technology, they're saying maybe in 1 year. There have been some studies in, I think, monkeys that were done that have shown some kind of promise. But you have to know that when we do get a vaccine, it has to be effective. And so, for example, SARS and the MERS vaccine, they were effective, and the patients who did get it, they did have a good response. So it's just going to take some time. until we know or we have enough information. For example, if we do say we're going to have it in 1 year, we're only going to be having enough data in 1 year to make that vaccine. And then we don't know if this virus, COVID-19, is going to mutate. For example, the influenza vaccine, people get it and they still get sick, right? And that's because they may have a mutated form of the influenza that got into them. So we have to be prepared for many. It's not going to be like a miracle cure that's going to fix everything. It's still better than nothing. So, it's like my best answer is we don't have enough information. Again, hopefully at the end of the year, we may have more. But those are the pitfalls or the challenges that are involved in making an effective vaccine.
I see a question. There's a question about whether or not you need insurance to get tested.
From what I understand, no. If you click the link, you basically put your location and then you can go. I know I personally got tested for it. I did not have to. I am insured, but they did not ask for any of my insurance information. I have patients who I sent to these locations as well, and they have not had any issues too. If you're outside of LA County, you may need like a doctor. Again, it depends on the county. Sometimes you may need a doctor's note, but at least in LA County, you can just go there. I know they are prioritizing in terms of appointments. If you are older than 65, you kind of get first dibs. And then if you are essential worker, you also get put to the top of the list.
Okay. Well, Jazakallah khair, that's all the questions that I have. If anybody else has any additional questions, please put them in the chat below. But Dr. Kamil, Zahra, do you have any other words of advice for all of us in light of everything that's going on?
Maybe what I will say is I know there's a lot of people out there who may not believe in the seriousness of the situation. There's a lot of fake information in the media, video circulating by, sometimes even people from healthcare about how this may not be, that we're overreacting and maybe a hoax and things like that. I will assure you, I've a couple months before I was working in the hospital, I did have patients. A lot of my colleagues have patients who are in the hospital, in the intensive care unit. What you have to think about is like these patients, they come in, they're so sick. And then if they were to pass away, they never get to see their family members. They don't get to, talk to anyone before they pass away. And that's like a very, very sad and very grave situation to be in. And you do not want to be the person or the community that increases the risk of that happening to the older members of our family or community. And 80% of people, they do fine, but it's still a very terrible disease to recover from. Even you and me, it takes a big toll. So it's not like the regular cold or things like that. It is a serious situation, and there are patients suffering and passing away from this. So please take it seriously. Please continue social distancing. I know it's very hard, myself included, with kids and family, and especially in the time of Eid and Ramadan. But please continue to socially distance, wear masks, hand hygiene, all that stuff.
Do we have any other questions? Oh, I see another question asking, could we go to work if everyone's wearing masks?
It depends on what kind of work and how far away everyone is. I recommend if everybody at work, if it's possible, to get tested before you start going back into work. Mask is obviously better than no mask. Again, it depends on the kind of job, and obviously everyone's situation is different in terms of finances and things like that. So that's a very personal decision, and it's up to you in terms of you assessing the risk at work and the risk of not working.
So we have another question regarding someone who has what may be symptoms. So they have a cough and a fever, and they're wondering if they can still go to do like food pickups. So like, for example, at the masjid, can they still come, pick up food, even if it's no contact, like picking up from a restaurant or things like that?
If it's truly, truly no contact, yes, but I do recommend if you're having a cough and fever, just stay home. anything you touch, even if you're being very careful, like even when you wear gloves, and the gloves can give you a false sense of security because you touch your nose, you touch something else, and other people can still touch that. So unless you really have no option, I do recommend staying home. I know the masjid's doing a good job with contactless, placing of food. So again, please, if you do have symptoms, please stay at home, recover. And then again, if to anyone who does have symptoms, things to go to the emergency room would be shortness of breath. That's one thing. If you're feeling like you can't complete your sentences, you're walking a couple of steps, you're getting short of breath, any confusion, chest pain, tightness, those are all things to go to the emergency room for. Okay.
Okay. Thank you for that. So we have another question regarding the extent of the lockdown. So does it mean that we need to continue being under lockdown or under the stay-at-home order until a vaccine is developed?
I know the governor, or was it the governor? There was a news article about extend for 3 months. I don't know how long it's going to extend. I know the White House put out a set of guidelines in terms of when states can reopen, right? I have it right here, and it basically said before a state opens, you need a 14-day decline in ER visits, a 14-day decline in positive case of COVID, a 14-day decline in COVID hospitalizations, and a 14-day decrease in COVID deaths. No state has met that so far. So you have to look at the numbers. And I understand it's a very difficult decision for anyone to make in terms of the economy, in terms of health. So I don't know if they're going to extend it until a vaccine is formed. And like I said, we don't know how long.
Or like it took 5 years for there to be vaccine. Is that something that is that the same time frame that we're looking at for?
No, I just kind of get that out of context. Like, the Ebola vaccine, the Ebola pandemic was nowhere as close as how bad this is. And obviously science and technology has gotten way better than it was back then. So like I said, they have said promising studies in animal studies that have been done so far. And the other thing I did want to mention is immunity. So if you were to get it, it's kind of like chickenpox, right? If you get it, there's a very high chance that you will not get it again. And so that's another thing that we're talking about. If enough people get it and then they recover pretty well, we have herd immunity too. So those are the two things. Either everybody gets a vaccine, or those who recover don't spread it around, and then obviously everybody else is tested so that the positive ones are isolated at home. So it's going to require a lot of testing, a lot of manpower to kind of get there.
So is that something that's been confirmed, that you can develop immunity and not get it again?
So there have been a couple of, I know there were some studies that came from China that, everybody's like, oh, reinfection. But if you look at these cases, they technically got reinfected within 1 week of getting okay. So who's to say they never really got okay? And it was just there, because it can last up to 1 month, the infection, in it's usually 2 to 3 weeks, but it can last up to 1 month, some cases 6 weeks. So maybe their immune system just took a while, and then there's also phases in that 1 month. There's like ups, like it gets pretty bad, gets better, gets pretty bad, gets better. So I know in the monkey studies that were done, I was reading, they infected these monkeys with COVID-19, waited till they got better, and then they shoved, it's terrible, little capsules of COVID, of the RNA viruses up their noses, and none of them got sick. Again, so again, this is to extend it to humans that it's supposedly you have pretty good immunity. And again, this information, we don't know how long the immunity lasts. Does it last 1 year? Does it last a couple of months? Does it last forever? Those questions we don't know, but at least in the short term, they seem to have good immunity.
Jazakallah khair. And then we have another question asking if you have any recommendations for hospitals in the LA area.
I can't speak to that, unfortunately. I can speak to my hospital, which I work for, which is pretty good. Again, every hospital, they're basically following the guidelines. The only way it's different is when you get to the ICU. that's when, because there's no proper guidelines as to what the steps are. So there are a couple of clinical trials that are going on, which means they're trying out medications in people who are really sick to see if it gets better and gets worse. I know my hospital is doing that. And I would assume many other major academic centers are doing that. So I would think a bigger hospital that has a lot of resources, a good ICU, if any, would probably be a good place to start. And also depends on how sick you are to begin with.
So asking, can you get COVID-19 by handling produce? The viewer was talking about seeing people excessively disinfecting fruits and vegetables on social media, and they're worried about contaminating produce with chemicals. Can you speak to that?
I am not too sure. I think it's never bad to be too careful. Obviously, there's a fine line in being obsessive versus, being too cavalier. I think I was reading you can wash them in vinegar and water, and that kind of takes care of a lot of produce, and also, yeah, I think that would be good. I wouldn't spray with actual chemicals. And obviously washing them, most vegetables and stuff, if you remove the skin, you should be okay. And then also depends how these vegetables were collected in the environment in which they were collected in.
And then we're at our 2-minute warning, inshallah. But any recommendations about types of face masks?
No particular recommendations. Yeah.
Okay.
Yeah.
That's a question.
Mm-hmm.
But yeah, I think we're good
just
on
to go back to
questions.
that, just as long as they're covering, your nose and your mouth, and they're pretty secure, anything should do their job.
So I don't see any more questions. If anybody else has any additional questions, please feel free to put them in the chat, inshallah. But Dr. Kamil, do you have any other words of wisdom for us?
No, I'm okay. Jazakallah khair.
Okay, well, Jazakallah khair for being here with us. And just so everyone knows, Dr. Kamil is also my cousin. So I am teasing her a little bit every time I call her Dr. Kamil. But Jazakallah khair for all of your wisdoms, and inshallah may Allah subhanahu wa ta'ala keep us all safe and healthy during this global pandemic, and inshallah we will all be reunited soon. So with that being said, question, can someone get corona or COVID-19 from cooked food?
It depends if you're getting from a restaurant, that was already cooked and the person handling it, sneezes or coughs or something like that. But if they're asking whether COVID-19 gets killed by heat, I would think so, but I'm not 100% sure about that. But from what I've heard, I think so. It would be killed by extreme heat from cooking, but I am not 100% sure. I'm sorry about that.
Okay. Well, and for being here with us and for answering all of our questions. We are now going to move on to our tafsir portion. Thank you again, Zahra, for being here with us. Inshallah, right now, we will ask that Kari Anas should be joining us shortly, right before or while we wait for him to kind of come on. Inshallah, tomorrow we will be doing our weekly Wednesday reflection with Mufti Wasim Khan, who will be joining us from Texas. Thursday, inshallah, we will have the IOK Seminary and ICNA Relief representatives joining us, inshallah. And then on Friday, we'll have Sheikh Farhan Zuberi from IOK. And our cam will be with Sheikh Ahmed Billu. Saturday, we'll have our weekly reminder with Kari Anas, and Sunday, we will have our Islamic quiz program. And the essay writing participants will be sharing their topics with all of us on Friday, inshallah, on how they will serve the masjid as future leaders. So inshallah, Karyanis will be with us shortly to introduce the speakers for tonight's tafsir.
I'm muted right now.
Assalamualaikum.
Alaikum assalam. I was there, but subhanallah, it was mute.
Oh, alhamdulillah.
Like 10 minutes ago, but subhanallah. Thank you so much, Sister Rahma. Alhamdulillah, wassalatu wassalamu ala ashrafi khalqillah, Muhammadin wa ashabihi wa man walah, wa man istanna bi sunnatihi wa iqtafa atharahu wa ihtada bi hudahu ila yawm ad-din. يا رب صل وسلم وبارك على سيدنا محمد في الآخرين وصل وسلم وبارك على سيدنا محمد في كل وقت وحين أيها المؤمنون الموحدون, respected brothers and sisters, respected believers, we ask Allah subhanahu wa ta'ala to give us lots of rahmah and lots of maghfirah. We ask Allah subhanahu wa ta'ala to protect all of us from the hellfire. إنه ولي ذلك والقادر عليه. A quick reminder before we start the tafsir. Tomorrow, inshallah, the night of Al-Qadr will be starting from tomorrow. As what we received from the Prophet Muhammad sallallahu alayhi wa sallam, التمسوها في العشر الأواخر من رمضان. If you wanna look for Laylatul Qadr, okay, you should look for it like on the last 10 days of Ramadan, which are like, these days are the odd nights, which is the night of the 21, the night of the 23, the night of the 25th, the night of the 27, and the night of the 29. So lots of clues and lots of hadith, say that the night of the 27 will be the Laylatul Qadr, will be the night of the 27, and lots of clues about that. And we believe it, inshallah, 100%. And there is another way to take advantage, because the other group of ulama said maybe like Laylatul Qadr will be 29, 21 or 23 or 24 or 25th or like 27. So to make sure, guys, that I don't want you to miss Laylatul Qadr, I try from tomorrow to make qiyam every single night from tomorrow. If you can't make it like on every single night, it's okay. You can make qiyam every odd night, which is 21, and the odd numbers. We like to take advantage, inshallah, of what we have left from Ramadan. The one who did not take advantage in the beginning of Ramadan, please, the rest of Ramadan, still there, please, take advantage of it. I would like to ask everybody, to mute, the voice, because I can hear lots of noise. I can't focus. All of you guys, please, mute, the speaker, because inshallah, shortly we're gonna start, with a family that who joined the Quran Academy, I think 2 years ago. They are a pure family. They are in love with Islam, with Deen, with Quran. We have a father and we have his kids. We ask Allah subhanahu wa ta'ala to make all of them, inshallah, among righteous. And we ask Allah subhanahu wa ta'ala to protect all of them. And we ask Allah subhanahu wa ta'ala to guide them all the time on the straight path. We ask Allah subhanahu wa ta'ala to grant them Jannatul Firdaus and give them the best of this dunya and give them the best in the hereafter. Tonight, a very special family, a very unique family. We have brother Nuh Saifullah, and we have Antoine Saifullah. We have his Nuh Junior Saifullah, and we have Jaslyn Saifullah. So please, brother Nuh, you can go ahead and start and introduce yourself to the community. They are watching you right now.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm brother Nuh, and this is my family. This is my son Antoine, my son Ibn Nuh, and Jaslyn. And what we're going to do, we're going to be going over the tafsir for the night. Like Sheikh Anna said, we joined the Quran Academy a couple years ago, and alhamdulillah, we've been rapidly learning a lot, memorizing, and by the grace and mercy of Allah, we can finish one day, inshallah ta'ala. So we'll start with my daughter. She's going to start with the tafsir, and we're going to just keep going, and each
By
one of
order.
us are going to read just a section.
Inshallah. Go ahead, ya Jasmine. Bismillah. Say assalamu alaikum first.
Assalamu alaikum.
Brother, please adjust the camera. We like to see her nice face. Please.
Okay, no problem.
MashaAllah, mashallah.
Okay.
Bismillah.
Bismillah.
Tonight's surahs consist of last portions of Surah Al-Furqan, Ash-Shu'ara, and An-Naml. We discussed Surah Al-Furqan last night. This surah was revealed in the middle Meccan period at a stage when the unbelievers were too proud and stubborn to listen to the truth. The conflict of unbelief with truth serves no purpose, so was the conflict of Pharaoh with Musa alayhi salam. Pharaoh's magicians vowed to Allah subhanahu wa ta'ala at last, and Pharaoh was drowned. Ibrahim alayhi salam's people gained nothing by refusing to listen to the truth he preached, and Noah alayhi salam's people perished because of their unbelief.
Thank you so much, ya Jasmine. Nuh Junior. Bismillah, habibi.
Bismillah.
Hud alayhi salam warned his people against relying on their wealth and their knowledge of architecture and construction, while Salih alayhi salam warned his people against disobeying Allah subhanahu wa ta'ala's command. In both cases, the sinners were destroyed. Lut alayhi salam had to deal with rampant indecent behavior, and Shu'aib alayhi salam against dishonesty in business dealing. Here too, the rejectors were destroyed. Likewise, Allah subhanahu wa ta'ala's truth was not accepted by the pagan makings, but the Quran is not a collection of immoral and vulgar poetry, like the poetry of the Meccan poets, and must win through in the end.
MashaAllah, mashallah, ya Nuh. Good job, mashallah.
So, Surah Assalamu alaikum wa rahmatullah. Surah Naml. Here there is a great deal of double meaning.
I thought you
Wonders
just
not-
fast.
Excuse me? Oh. Here there is a great deal of double meaning.
One second, brother. Please, everybody, please, mute speaker, please. Everybody, please mute the speaker. We can hear noise.
Alhamdulillah.
Go ahead, brother.
Alhamdulillah. Surah Naml. Here there is a great deal of double meaning. Wonders in our physical world stand for much greater wonders in the spiritual world. In the story of Musa alayhi salam, the ordinary fire to which he went also stands for a light from the spiritual world, i.e., he was seeing the light of Allah subhanahu wa ta'ala's truth and guidance. Musa alayhi salam drawing his hand to his side, thereby making it shine brightly, also means that his hand was glorified. That is, it had become a clean and bright object fit to carry out Allah subhanahu wa ta'ala's orders. Even his rod could be changed into a snake to defend him. Sulaiman alayhi salam knew the speech of birds, meaning he could communicate with them. It is obvious that they do not speak to one another, but communication among them does exist. He kept the jinns, men and birds in orders and ranks, which means two other things also. One, all his subjects, despite their different tastes, occupations, and levels of intelligence, were looked after by him with justice and discipline. He had many gifts. He could understand birds and beasts. He was wise and obedient to Allah subhanahu wa ta'ala. He used all of these gifts properly, as if they were a well-disciplined army, thus getting the best possible results from them.
MashaAllah.
Allah subhanahu wa ta'ala's revelation is wonderful, like the fire which attracted Musa alayhi salam. This fire of Allah's inspiration ordered him to reform his people. The showing of his miracles made some realize the truth, while others rejected it. Sulaiman alayhi salam knew the speech of birds and had these creatures as well as jinns and men under his command. The queen of Sheba had a wonderful kingdom, but realized that it was nothing compared to Allah subhanahu wa ta'ala's kingdom. So she submitted with Sulaiman alayhi salam to the Lord of the worlds and became a Muslim. Fools regard Allah subhanahu wa ta'ala's punishment as ill luck rather than a warning. as Salih alayhi salam's story. They do not change their ways, so Allah subhanahu wa ta'ala destroys them. Allah's glory rules beautifully over everything. Unfaith will be conquered by faith. So follow Allah subhanahu wa ta'ala's message, serve Him, and trust Him. Jazakumullah khairan.
Jazakumullah khairan. Brother Nuh, like this, like, talk to you, like, in front of the community, like, I want them to know that Brother Nuh does volunteering job for the masajid. He goes to masjid, like, to do khutbas, to help as much as he can. At the same time, he does some videography, photography, like, on top of that, like, he's a father. And myself, like, as a Quran teacher, as an imam for Islamic Center of South Bay, I give, like, right value to each student. Like, uh, I know the intention sometimes of the student, like, when they come to Quran Academy or when they come to learn Quran, I know this guy is honest, or just he wants to come just, like, to pass the time, or just, like, to waste my time. Honestly, uh, uh, like, the one, all my students, like, know about me that I like to say the truth. I like to be honest. I don't like to give credit or like to give compliment to one of my students in front of the community to show off. No, wallahi, Allah subhanahu wa ta'ala is watching me and watching us. Like, when I say something truth, like, when I say something, it has to be the 100% truth. I don't, like, play left and right with my words. So Brother Noah, like, he was, like, he is an amazing guy with his family. They have lots of commitment for the Quran Academy. They come on time, they do their job all the time. They don't miss class except, like, for a very bad situation. If they have that situation, they don't come, and this one happens maybe, like, once a year. That's why, mashallah, when Brother Nuh, when he started learning Quran, like, in the Quran Academy, he finished, mashallah, 3 chapters memorization. Same thing, like, with Antoine, mashallah, he finished, like, 3 chapters and a half. We have his, like, son Nuh Jr. finished, like, almost, like, chapter and a half. Jasmine, mashallah, she finished, like, 2 chapters. But the Brother Nuh, don't mind if I ask you this question. Aren't you old to learn Quran at this age while you have lots of responsibilities?
Mm-hmm.
Aren't you old or what? Tell me.
Oh.
Tell people the truth. Tell people, like, how important is the Quran. People, like, know Sheikh Anas, like, they know Sheikh Anas likes to talk about Quran, likes, like, to give compliment to his student. But I want you as a Brother Nuh, to say the truth. I want you, like, to tell people, like, about, the Quran Academy, about, like, the service we give, like, for the student.
Definitely. Yeah, like you said, I picked up the Quran at a later stage. And one of the reasons I did it was to, I guess, facilitate the learning of my children. And I always knew it was something in my life that was missing. I was a Muslim doing what I was supposed to do. However, the Quran and learning the Quran, it completed me. And a lot of the times when we get older, we think, oh, I'm just gonna teach the Quran to my kids. It's over for me. I'm too old to learn the Quran at this point. But the Prophet sallallahu alaihi wasallam, he was 40 years old. 40 years old when his Quran journey started with memorization and everything. So we're extremely young. And it's never too late to learn the Quran. It enriches your lives. It corrects the behavior of your children. It brought us together more as a family, learning the Quran all together. This Quran Academy, it helped the camaraderie within us. It provided much education and nur in our family, and it calmed us down as a family, and it brought us together. So I think that this connection with the Quran and going to an academy, I think it's a necessity for every family. It's a necessity, even if you are a hafiz, you will have to go to keep renewing this Quran in your life. So we as parents, we can't think that this is something just for the children Or if the children don't have it, we can't think of it as something that they don't need. They need this. The children need this, and we as parents, we need this. We need to be doing this all together. And Sheikh Enes, mashallah, he's my brother, and me coming to the Quran at an older age, he never made me feel embarrassed. He never came at me and said, brother, why are you just now learning the Quran? No, always treated me with respect, always had open arms, always treated me like a brother. He's the reason why I'm still going on my Quran journey, because he's not going to let you slide. He's still hard on me. However, he does it with compassion and with love, and he treats the kids the same way. And I think that this academy is a ni'mah from Allah subhanahu wa ta'ala. It's a favor. It's what the community needs. So, Sheikh Enes, Jazakallah khair to you and to your family, to your brother, to your dad, everybody. Thank you all.
Jazakallah khair, Allah, brother Nuh. Like, inshallah, one day, inshallah, we're gonna invite you, like, to do, like, a speech about Quran. We really love your speech. We really love your words about Quran. And I believe, like, I could tell, like, the words that just said, like, they came out from your heart, not like just from your tongue. We ask Allah subhanahu wa ta'ala to reward you. And people, like, think that you live around the masjid. Like, he comes from, like, Long Beach, from, like, very far. Like, he travels, like, he travels, like, more than 15 minutes sometimes when you have traffic, or when you come, like, in the daytime. So Jazakallah khair, brother Nuh. Jazakallah khair, your family. Jazakumullah khairan, everybody, like, who works hard for the masjid. Everybody, Jazakumullah khairan.
Ameen. Jazakallah khair. I appreciate you. Assalamu alaikum wa rahmatullahi.
Wa alaikum assalam wa rahmatullah. Rahma, is there any announcement for tonight, or should we start the recitation?
Alhamdulillah, we're good to go. You can definitely start the Quran recitation, inshallah. I made the announcements earlier.
I forgot to thank Sister Dr. Kamil or Sister Zahra. I think she got a new baby, like, a week ago, right?
Yes, yes.
We ask Allah subhanahu wa ta'ala to protect her and protect Brother Shabir. He's one of the IT group we have in the masjid. Jazakumullah khairan, everybody. Sister Rahma, thank you for seeing tonight. We ask Allah subhanahu wa ta'ala to reward you and put lots of rahmah, inshallah, in your heart.
Ameen. Jazakallah khair, Sheikh.
Inshallah. I will go ahead. First of all, everybody, I want you to guys give me, like, thumbs up if the reception or if the recitation good. I want you to hear me, like, clearly. Like, I want to